Welcome to Creative Caregiving and Beyond. More and more people are having to become caregivers for their elderly loved ones, and navigating this journey can be really difficult. This podcast will provide guidance and give practical tips for your family. Your host is Wendy Whiteman, elder law attorney, author, speaker, and leading insight advisor in senior protocol and senior lifestyle trends. Know that you are not alone in getting the help that you need. Let's get started. And here's Wendy.
Well, welcome to Creative Caregiving and Beyond. And this is where we discuss all things related to the elder care sector. And today we have a wonderful guest, Jennifer Riggs, who's a LVN as well as director, regional director of business development for Creative Solutions Healthcare. So Jennifer, welcome.
Welcome. Thank you. Thank you for having me, Wendy.
Thank you. Thank you. And I just want you to kind of tell our audience, just give them an idea about your background. I know you're a nurse, you have a licensed nurse certification, but yet you're in the long-term care arena as well. So how did that happen?
So I started my career as a CNA. I worked very closely with memory care, secure care units when I was in my CNA days, and I worked my way through nursing school as a CNA. When I started working as a nurse, I think what you mean is business development. I'm in the business development side of healthcare now, which is so you don't often see that. But I was afforded the opportunity by one of my administrators. It was by happenstance, and I've never looked back, quite honestly. I will say that in my time as a nurse, I noticed some systemic changes that were needing to be addressed, and I feel like they can be appropriately addressed in business development, ironically enough. As like communication and resource allocation. Yes. I feel like these are some things that could be addressed with appropriate business development. My nursing background gives me a unique perspective to see both the operational and the clinical side of a skilled nursing facility. Therefore, bridging that gap between families and the care providers that we work with.
Okay, awesome.
That was a very long-winded answer.
No. I mean, that's great because you can see it from a different lens, and that's important in this field.
It is. Yeah. I'm actually shocked, and it happens more than I even realized, but there aren't very many nurses that are in the business development side of healthcare. And I've often wondered how, but it's a learned trade. But I will say that it has given me a competitive edge, and really has allowed me a perspective that maybe others don't have.
Yeah. Well, you've got that training, plus you've got a great personality for business development.
Thank you.
So that's a winning combination, and I'm sure it's probably a rare combination too.
I would hope it isn't, but it could be.
And I understand you had a journey of your own, a personal journey with your grandmother who had Alzheimer's. Can you share how that's impacted your role today?
So yes, my grandmother passed away 4 years ago after her 12-year battle with Alzheimer's, and watching that experience was deeply personal and transformative for me. In the last years that she was alive, she received both excellent care and subpar care. Because of that experience with my grandmother, it helped me realize that families really need help navigating in those times of their life. And so again, it goes back to that perspective, that unique perspective, having the personal side, having the clinical side, and the operational understanding of a skilled nursing facility. Hopefully I can lend just good and trustworthy advice to these families.
Yes. Yeah, I mean, your personal experience makes a big difference. And that's one of the reasons why, I wrote my book and the podcast, because of the personal experience. And it really makes you very genuine when you're dealing with families and what they're facing. And so what are some of the challenges you would say that families are facing that you are addressing, quite often, and can help them, if you could share with our audience, and navigating this whole area?
I would say I often see that families are struggling with guilt. They have guilt. That's the first thing that I always see, their guilt. Lack of clear information and lack of understanding as to the level of care their loved one may need. So when I speak with families, and now that I'm in a position where I help others in this role in business development, I train them and I coach and mentor them to lean on the edge of empathy when they're driving these conversations.
Okay.
While we are in business development, while I am in business development, this is not a used car sales position. These are people's families and their loved ones in their lives, and it should be handled with care. So I think leading with empathy and having that empathy in the back of your mind when you're speaking to them, and or in the forefront of your mind when speaking to them, and just leading with honesty and transparency and communication. Communicating is a huge part of it as well.
That's wonderful. That's wonderful. Because it's a very sensitive time, a very emotional time for families, and most people have not been through it. I mean, there's nothing that can really prepare you for something like this.
There is nothing that can prepare you for this situation, nothing at all. And it's a very niche situation to be in. Unless you've been in it, you don't know anything about it. I'm sure you see that quite often.
Yes.
Yeah.
That is so true. That's so true. Well, it's great to have, people like you and people in places of business and management to relay that message. And how do you relay that message to your staff, case managers, case workers, and social workers, and just general staff in your company? How do you relay that caring and compassion attitude to treat the families in that manner?
Well, first by example.
Yeah.
And secondly with education.
Okay.
I think that understanding the importance of trust is where education begins. There is a term in the business development world, in marketing, data is the new donuts. This is something
don't mention donuts now. You're making me hungry.
Well, and what I mean by this is rather than going into a referral source or a case management or a hospital with a dozen donuts, I'm going in there with quality measures. I'm going in there speaking on comprehensive wound care and how this facility is healing arterial wounds in 7 days versus the national average of 46. You see what I'm saying?
Yes.
So I am helping to educate the case managers on where to appropriately place the patients that come into their care, right? So my goal is always to give them the tools that they need to do their job effectively, essentially.
Awesome. Awesome. I'm sure that's much appreciated too.
That's the perspective that I take when I'm working with my case managers and my families. And I've seen success with that, so I would hope others would do the same.
Very good, very good. Well, I know, Jennifer, you are just amazing, and you're very active in the community. You're president of the Tarrant County APS Board, and you're a member of Kindred Southwest Healthcare Disparities Board. Wow. And so how do these roles support your efforts in improving the facilities for the elderly?
Right. So you remember in the beginning when I was talking to you about that systemic change that I was identifying early on in my career? Well, in these roles, especially with APS, I am able to help vulnerable members of the gerontological population within my community. And at the end of the day, working with other professionals, that truly does drive that systemic change that I had identified early on in my career.
Okay.
Yeah.
Okay.
So on APS more specifically, as a board, we're able to drive initiatives that help the well-being of older adults in our community. Yeah.
Well, and that's much needed, I'm sure. I mean, have you guys seen a rise in the amount of people that actually need help in the elderly sector, and reports that come in through APS?
Absolutely, yes.
Wow.
And of course, I am not an employee of APS by any means. The Tarrant County Community Board supports APS and APS staff, but a huge part of our job in this volunteer role is getting the word out there, spreading the initiative, helping people to understand that APS is a resource and it's not punitive.
Yes.
Of course, it can be punitive, but APS has such a negative connotation.
Yeah.
And I mean, have you seen that?
I didn't know that these other resources were available through APS.
Oh, yes.
I had no idea.
Oh, yes. As an example, on the board right now, we are working a community campaign to build our Silver Star room. And the only way I can explain this is for CPS, Child Protective Services, they have a rainbow room. And it's where families with children can go and get resources that they may need, supplies that they may need. The elderly have the same thing for APS. It's called the Silver Star Room. So in the summertime, they have fan drives, and in the winter, maybe heater drives.
Yes.
But they can go there and get briefs and maybe household supplies, insure, things that they need and don't regularly have access to.
Wow, that's amazing and much needed.
Absolutely, and there are many more resources as well, but that is just one. Actually, Tarrant County APS Board, we received an award this past year from the national APS level of Tarrant County.
Wow,
Yeah.
amazing.
I know, it was awesome.
You guys are doing a great job. Great job. So
Thank you.
You've got leadership skills in the corporate sector as well as in the community. And so how are you using that, incorporating that to make sure there's quality care in your company, at your company, and all companies that you come in contact with?
I think by leading with empathy, I'm a servant leader. First of all, I'm a servant leader.
Okay.
I strive to be a servant leader. How can I help you? By coaching and mentoring those that I work with, of course, but then fostering a culture of continuous growth and education. I think this is important. We are, as people, we're ever growing.
That's true.
It is, and we're
always growing.
We're always growing, and we only know the perspective that we come from.
Okay.
I think it's important for us to broaden our horizons and understand that not everybody lives or works or breathes in the same environment that you or I do.
Right.
And it honestly all goes back to empathy.
That's true.
Leading with empathy.
That's true. That's true.
Yeah.
And families are structured differently today as they were, 30, 40 years ago. So the things that we're seeing with our elder care community and families, they're more spread out. They're, you've got, children that may live in another state and family members.
And cultural divides.
Cultural divides. So we're faced with a lot of different things we never thought we would be faced with, even 20 years ago. So there are a lot of things, a lot of diversity.
Interesting. You're right. You're very right.
Yeah. So what trends are on the horizon? Trends and new innovative ideas and or even ways to help the gerontological area that you know of that's coming up?
Currently, a huge initiative that I know the APS board is working on is just changing the perception of APS, like I mentioned earlier. We are helping, of course, like I said, build that robust Silver Star room. But another thing that we're hoping to push out there is build a robust resource catalog for not only APS staff and those who utilize APS, but also hospital case managers, referral sources. We want to make sure they have the tools that they need.
Oh, very good.
Another big initiative for this year is, it's very exciting. It's and maybe you could give me some feedback on this. It's Texas. I'm going to look at my notes here. Texas Legislative Bill 2187. It's also known as the dumping granny law. So Texas just passed a bill stating that you cannot take an elderly loved one or someone that you know to the ER and dump them. And this is a common occurrence. I was shocked to hear it, and then I wasn't shocked to hear it because I deal with hospitals so often, and I hear about these elderly people who are stuck at the hospital. Their loved ones have just dumped and left them there. So similar to the safe baby surrender signs that you see. So we're developing a program right now with education materials, but also signage to put outside of ERs. And we don't know what that sign looks like as of yet, but we would like to develop these programs. And of course, we will introduce them to the hospital leadership, and they will have to go through their legal department, all the things, right? But we would like to get this up and running to help build a greater understanding of what happens when you do this, but also resources for families, because that is not your only option.
That's true.
So this is a big one that we're working on.
That's huge.
Yeah.
That's huge. I mean, you wouldn't fathom someone doing that, but it happens enough for legislation to come on place to protect them. That's amazing.
I know. Have you had experience with that? Have you seen that in your career?
Well, I have actually. A few situations where I've gotten calls and there have been like Madam X or Mr. X situations where no one knows who they are and they have no loved ones, and we've had to do, investigative follow-up to see if we could find relatives and get them placed, and it's pretty sad, but I'm glad that there's legislation out there.
I am as well, and I think the ones that are really sad are, I've spoken with case managers helping them try and help place elderly individuals that have psych issues, and they're found,
Yes.
and they were not homeless previously, but they are just found wandering. And Jerry Psych is another underutilized sector of healthcare that I wish we could build up. But
Yes, for sure.
I'm so glad Texas has put this into action, and so now this is another thing that this is another thing the Tarrant County APS board does to drive the initiatives of APS.
Wow.
At the end of the day, it's about helping families get the right resources and helping referral care providers and referral sources have the tools they need to succeed.
Wow. Well, there's so many moving parts to the whole elder care sector, and you guys are doing a great job of making the public aware, and hopefully this podcast will help members of our audience become aware of what's going on as well, and resources that are available.
Yeah.
So what advice, if someone's thinking about becoming a part of the process and working in the gerontological area, what advice would you give someone who's coming aboard, or someone's graduating from college, or maybe even current staff? What advice would you give them to make their journey and more impactful as they meet with families?
I would say be genuine. Be empathetic, of course. Be genuine, be empathetic, and be proactive.
Okay.
Be proactive. I think it goes back to that understanding of perspective.
Yeah.
I've often been faced with situations in my own career that look nefarious,
Yes.
and that's without understanding the background behind. So I think if you keep an open mind and are empathetic, you will have a successful career. But at the end of the day, these are loved ones of people just like you and I.
Right.
These people have sons and daughters and had mothers and fathers at one point. They have siblings, and they're people, and they
That's
had
true.
full, thriving, flourishing lives before they were in the position they're in today.
Yeah.
So I would say keep that at the forefront of your mind.
Yeah. Very good. Very good. Now, if there was one thing, I'm just going to throw this at you,
Yeah.
if you can think of something that you would like to change in the elder care space, what would that be?
One thing that I could change. Honestly, more advocacy. And I say this, again, coming from the APS side.
Yes.
CPS, everybody knows about CPS.
Yeah.
Most people know what CPS offers. Not a lot of people know what APS offers. And I think advocacy, advocacy for the elderly. I think financial exploitation is a big one.
Yes.
These adults are vulnerable, and they're in situations, sometimes with loved ones. So just advocacy. And that's where groups like APS and TAGS, Tarrant Area Gerontology Society, and DAGS, Dallas Area Gerontology Society, and these volunteers of professionals that come together with one purpose and goal to provide education, innovation, education to not only the population that we work with, but the professionals that work with that population as well.
Yeah.
Yeah.
Very good. Very good. Well, Jen, thank you so much.
Thank you for having me.
For coming on the podcast. You have given us so much information, and I'm sure we're going to get a lot of feedback about that, and it's going to help a lot of families
I hope so.
navigate this process. Thank you so much.
Thank you for all you do as well.
Thank you. Jen, thanks so much for coming on board and being on the podcast. That's been a great information. And if families need help with placement or questions about placement, how would they contact you?
You could reach me at Jennifer_Riggs@csnhc.com.
Okay.
Thank you for having me.
Oh, thank you. Thank you for being a part of our show, and thank you for tuning in. Don't forget to subscribe and like our podcast, and we'll see you next time.